Congratulations on taking the first few steps towards a healthier lifestyle. There are many beneficial things that can happen if you continue on this journey. My name is Laura, and my job is to assess, diagnose and treat dietary and nutritional problems. I use the most up-to-date research on food, health and disease and translate that into practical guidance to enable people to make appropriate lifestyle and food choices. This can actively help to reduce the amount of fat in your liver, which can help to slow down, stop or even reverse your NAFLD. As well as improving your NAFLD, eating well and moving more can help to move towards a healthier weight or maintain a healthier weight and reduce the risk of associated conditions such as type 2 diabetes and heart disease. And it can have a positive impact on your mental health and well-being. So healthy eating is about having a balance of different foods and nutrients in your diet for good health and well-being. It's not about dieting, it doesn't have to be boring or difficult. Healthy eating is about enjoying your food at the same time as being mindful about what you eat. Try to include plenty vegetables, fruits and whole grain options. Try to replace meat with pulses at least twice a week. Reduce your choices that may be high in fat, saturated fat, salts and sugars. Limit fatty and sugary snacks. These usually are high in calories but don't offer much other nutrition. And a balanced diet should provide all the necessary vitamins and minerals you need. So the first question to ask yourself is, do you feel ready to start making changes to your diet? And if the answer is yes, then you may find it easier to change your diet in small steps. Be clear about what you want to achieve, and setting well-defined, measurable goals is often the key to success. Think about 2 to 3 small changes and follow that up with an action plan. Secondly, I would consider these key areas to work on. So plan ahead and make sure that you've got healthier foods to hand at the right times. Aim to have 3 regular, well-balanced meals a day and avoid excessive snacking. When you think about your plate, fill half the plate with vegetables and salad, and then divide the other half of the plate into a quarter of protein, so lean protein, and maybe things like fish and beans and pulses and eggs. And the other quarter should be what we call starchy carbohydrate foods. So this may include things like whole grain rice and pasta. Aim to reduce portion sizes by reducing your plate sizes. Eat slowly, concentrate on your food and enjoy your food. And think about reducing your alcohol intake, so cutting down or stopping. You may want to stay within the alcohol guidelines, which are less than 14 units a week. You may want to consider a deeper understanding of your readiness to change. So consider the advantages and disadvantages of making changes, and then also think about what challenges you might face. Thinking ahead and working through these problems can help you stay on track. Most people have tried to eat more healthily before, so understanding what went well and perhaps what you might do differently is incredibly useful. Accept that life circumstances can throw up challenges. That's a normal part of lifestyle change, so keep positive. My top tip is that there's no quick fix. People who successfully change their lifestyle, set personal goals, and develop new skills to make their new lifestyle and activity habits an enjoyable way of life.